Hey everybody, this is Jerry Wan, your host of Dear Asian Americans. And I wanted to take a break just for a little bit from sharing important Asian American origin and identity stories to share a conversation that I had earlier today with Dr. Paul Song, who is a radiation oncologist based here in Southern California, who is also extremely involved with our community, Asian American community here locally as well. So I wanted to have him on the show and share with you our conversation on his latest take on what's been going on both here and globally, some tips that we can share for ourselves and with our family members, particularly our parents and our elderly family and community members, to keep them safe, and just his thoughts about what's been going on. So I hope everybody is staying safe out there. Wash your hands, limit your large gatherings, stay home if you can. And yeah, I just wanted to have this conversation with Paul to share this with you. So hope you enjoy. Please let us know in the comments or email me, Jerry at dearasianamericans.com. If you have questions, if you want to reach out to Paul directly, please let me know after the video. And I hope you enjoy my conversation with Dr. Paul Song. So I want to introduce you to Dr. Paul Song. He's a radiation oncologist. And on this special edition of the The Asian American Show, I wanted to bring on an expert, a medical expert, who can share with us his thoughts on what is going on, not only from a medical perspective of the pandemic that it is, but also what things we can do from a response perspective, both locally in our own homes and communities, wherever you may be listening, and as a country. And I know that we have some listeners from outside of the United States. So, I just wanted this to be a, more of a global conversation. Dr. Paul is somebody I've known for a very long time and respect, and he is respected in the medical community. Also, very active in our Asian American community as well. So, Dr. Paul, I just wanted to say thank you for making time on such short notice to join us today.
Well, thanks for having me.
So we're recording this on Thursday afternoon. So to put things into context, yesterday evening, President Trump spoke to the nation from the Oval Office, which is a pretty rare occurrence. And, the travel ban from most of Europe was instituted. There are things that are happening that are causing a little bit more concern. More notable people, some NBA players have gotten the disease or have been confirmed to be positive. NBA is done for the season. There's so many things that are now, I think, are more real life affecting than maybe some of us thought maybe even a week ago. So from your perspective of where you're sitting of observing from a medical perspective, what is the situation that we should be concerned about now, and what are we looking at it as we look to the weekend?
I think certainly in the immediate short term, we have to be very concerned about how this affects our own loved ones, particularly if we've got senior citizens in our family. They are by far at the greatest risk. So really being careful and protective of our immediate families is the first thing. And then also us as a community really trying to come together and realize that this is not a right versus left issue, that this is really something where instead of attacking one another, this hopefully could be something that unites us and brings us closer together. Instead of focusing on hoarding toilet paper and things of that nature, maybe we should also look at caring for those people that may be by themselves. So one example is I've been hearing, particularly among the Asian American community, is a lot of seniors live by themselves or in assisted living facilities where they no longer have access to their friends and family because of the quarantines that a lot of these places are having in terms of letting outsiders come in. So one is finding ways to actively reach out to these people who are living alone to find out what their particular needs are. You may not be able to go visit them directly, but there may be things that you can have them sent, care packages of some sort. So I would say those are the immediate things. And the biggest concern, I have an 88-year-old mom who I know that if she's exposed to this could be the end of her. So I think each and every one of us probably has somebody we identify with that. And I would say that's the immediate priority. The good thing about this illness so far is that it doesn't seem to be affecting kids. So that is an area that maybe we have to be less vigilant on, other than making sure that they wash their hands and carry out good hygiene. But really it's the seniors in our family and the people over 65 that we really have to make sure if they're not taking precaution, that we really force them to do that. So within the Korean American community, I would say a lot of our parents will go to a Bible study or to church no matter what. And even that, I would really recommend. I told my mom she really cannot go to a public place like that, and that she will have to find other ways to nourish her soul, and that God will understand. But really, I would say the most immediate thing is for us to really be vigilant with the seniors and our loved ones.
So, question about that, because I have parents who are nearby in LA that is drivable, but they're in their 60s and with not perfect health conditions, as many of our parents are, unfortunately. Are we talking like tell them to stay home and figure out ways to have food and things delivered to them? I say that because I think there is a comfort level in knowing, oh, it's just a supermarket down the street, but also in particular pockets of high density immigrant communities, people are still coming in from Asia, and they may not be being fully vetted or tested. So you don't know, you go to the supermarket or wherever, you don't know who you're going to be in contact with. And I guess as a follow-up, if we were to start ordering food completely online or, doing Prime Now or even dropping off stuff for our parents, topical concerns of the actual things versus, if we're not doing human to human contact, but,
Right.
Do we wipe down cartons of milk at this point? How do we do that?
Well, one of the things that a lot of I think stores are going to eventually implement is to have gloves, that if you're going to go touch the fruit or vegetables, that you're going to have to wear gloves before that. I think that with regard to milk and a lot of those containers, they've been refrigerated for some period of time, and there may not be the risk there. But getting back to your parents, I think not every 65-year-old is the same, right? You have some that are very robust. But let's say if one of your parents has a history of smoking and has developed bronchitis on numerous occasions, that's the type of person that I think is at high risk, that if they got infected, they could really run into big problems, since primarily the biggest cause of damage is to the lungs. So I think you have to put everything within some context. The reason we say 65 and older is if you look at where the death rates have spiked, it is just in that population. But again, there are some very robust 65-year-olds who are probably healthier than a lot of 40-year-olds, and we're not saying all of them need to do that. The biggest thing I would say for anyone listening is look at your own immediate health. If you are showing any fever and cough, you should really go get checked. The coronavirus generally is associated with really bad fever and cough. But if you don't have a fever, then chances are you may just have the flu, or you may just have a bacterial bronchitis. It's people that have a persistently high fever, because again, most adults, why would we get fevers? Kids get them with ear infections and things, but for us adults, if you ask, when was the last time you had a fever? It's really hard to remember, right? So I would say that anybody who is an adult who has a fever and even just a trace cough, they need to go get checked out. The other problem is we as a country, the United States, is woefully unprepared at this moment to test for this. To put in perspective, Korea, which has a population of only 50 million, so 1/7 roughly of ours, is doing more tests per day than we can in the United States right now. So even if your people watching this feel like they have the symptoms, there's no guarantee they're going to be able to find a site that has a test. The second thing, though, is if you do indeed have a temperature and have a cough and suspect you might have this, the last thing you should be doing is home isolation, because you are really exposing your family members to this. And that's really how this virus is spreading, more so than people going out into public spaces. It's people infecting their family members who then go out into public spaces, and it multiplies. So I really think the first thing people need to be aware of, if you don't have a temperature and you feel sick, chances are you don't have the coronavirus.
And so say more about that, because some of the concern out there, and we've heard stories from Italy about, having doctors having to make really tough choices on who stays and who doesn't get to stay. What is your thought on, being precautious, and at the first sign of anything, doing what we would normally believe to be the right thing and go make an appointment or go sit in an ER waiting room or whatnot. But also that poses risks to what I'm also hearing from friends and hospitals that are, the systems are already clogged. You know, if you, how do we judge that? Like, should we go versus is it the better public health to not clog the system?
So there's this fine line between panic, overreaction, and then being proactive, right? The problem with our current healthcare system and the way the government has responded up to now is we don't have dedicated testing centers like you see in China and Korea. So if you feel you have this, and indeed you do, and you walk into an ER, you're now exposing the entire
Right.
staff there to coronavirus. So I'm hopeful that in the next 2 or 3 weeks, the government and the health authorities realize this is much more serious and start to set up testing centers that are dedicated to doing that. So like in countries like Korea and China, you have these drive-up stations
Right.
where the healthcare workers are fully gowned and protected, and then they can do a rapid test there. And then if you are positive, immediately put you in a quarantine in a public place. We need to start setting up, gymnasiums and things of that nature specifically to quarantine people and take them away from their own family members. You don't let them go back to their house and say, wait for your results. Those are the types of things that we need to do. And really, I would say, put it in the perspective of, while everyone thinks this started in China and now there's this fear, you can say that China and Korea are the two countries that are actually being lauded for the response to coronavirus, where countries like Italy and the United States are largely being criticized, and rightfully so, for their woeful response up to now. Let me just tell you what they've done in China and Korea. So other than the drastic, closing cities up and things of that nature, they've been very active, and basically anyone who has a temperature is immediately tested for the coronavirus. They will sometimes do chest first for the flu, or even do a chest CT scan to make sure they don't have a bronchial pneumonia caused by bacteria or the influenza. But they also will then go do the testing. And as soon as they test positive, they don't even have the option to go back to their house to get things. They're immediately sent to a facility with other people that have also tested positive. Now, for those people that develop severe respiratory illnesses and things of that nature, that may require admission to a special area where you have ventilators and all of the necessary treatments. But the problem that our US system has been saying is, go home and self-isolate. And chances are a lot of people don't live at home by themselves.
Right.
So that's not really self-isolation. Secondly, it gets back to a lot of people don't have proper insurance and they have high copays and deductibles. You heard the president yesterday say that he was going to work with insurance companies to waive those copays and deductibles for the testing. And maybe that will allow people to then go and get the test that they need if they think they have it. But you had roughly a 4-week span where a lot of people may have been exposed, but because they simply didn't have good insurance and they had a $200, $250 copay, they didn't go to the emergency room or the doctor to get tested. And as a result, for the last 3 or 4 weeks, they've been walking around infecting other people. And we may now see the problems of that. So overall, our response has been quite poor, but it's not to say that we collectively as a community can't start to come together to make this better. As far as self-quarantining, I would say this. You see sometimes with kids in daycare, you drop your kid off in daycare and there's another kid there with a runny nose and you're like, why did his parents let him come? Because chances are his parents didn't have another option to take care of him. They had to go to work. What I would say to everyone here, not so much for your kids, but as soon as you feel the sniffles, a cough, as soon as you feel any symptoms, the last thing you need to be doing is exposing your workers, coworkers, or your staff to that. So, at our company, we've instituted policies that the minute you feel that, just take sick leave and we'll take you at your word, because it's better to be proactive. With regard to our community, in terms of how we support small businesses and things of that nature, I think we should try our best. If you really feel good, go use hand sanitizer, keep your hands clean, avoid touching your face, but really go and support the community. But if you do feel the slightest bit run down, chances are you probably do have the flu, not the coronavirus. But if you're going into public places, into a H Mart, then you really are putting the community at harm. So I think there has to be common sense on that end as well.
Speak to a little bit about your colleagues in the medical profession. I have some in my family, so it's very personal to me. Doctors, doctors, nurses, pharmacists, and the like are almost being asked, not only asked to, but assumed to, fulfill your duty and go to the front lines and give it all you can. But those people have families, and those people have, parents, and maybe they themselves are, weaker immune system than ideal. How do we encourage our fellow medical professionals now?
Well, I think, again, our government was woefully unprepared. So a lot of hospitals, there's shortages of the N95 masks. There's shortages of respirators and ventilators. So this is a real problem. If you look at what happened in China with the first doctor to blow the whistle, he was in his 30s. He said this is a serious problem. He was so dedicated to taking care of patients, he ended up getting infected and dying. I do think that precautions are being taken at hospitals. Now, I worry about the sole practitioner doctor and his nurses who have somebody come in through the door who then exposes their staff, and they maybe didn't have the proper masking and things of that nature. So I do think that there is a real risk. I would just say to any healthcare professional or people who are at a higher risk of being exposed to people who are infected, whether it be firefighters, paramedics, things of that nature, they really do need to take more precautions. You're seeing more doctors asked to do consults over the phone, whether it be FaceTime or a Zoom app like this. And I think that's going to become the new norm. But until our government and the healthcare officials set up dedicated testing areas, sadly, you're going to have people who get sick who are going to go straight to the ER and bring those viruses, bring the virus actually into the hospital, exposing all these people. So again, our response up to now has been pretty bad. But it's better late than never, and hopefully you'll see rapid action in the next coming days, because as Dr. Fauci, Anthony Fauci from the NIH said, this is going to become a big problem. I mean, we're going to see tens of millions of people in the United States come down with this infection. The good thing is, as more people are diagnosed, we're seeing the overall mortality rate is actually probably going to come down. Right now, it's estimated between 1.5% to 3.5%. But the issue is not enough people have been tested. And I think if you really looked at the total number of people infected, it would probably be closer to 1%. But to put it in perspective, the flu basically kills 1 out of 1,000, whereas this right now is killing 10 to 20 times more than the flu. So that's the real problem.
I think there were some concerns that, just even myself I think for a long time, the narrative here in the States was, don't worry, we don't have that many confirmed cases. Then, as a scientist and as a data person, it's like, well, if you don't test them, you don't find them. And if you don't find them, you don't report them. So I do hope that we get to a point, will we ever know the true number? We hope so. But, with the challenges of testing, I think the state of Colorado has instituted some form of drive-through testing late yesterday, early this morning, to try to, learn from what the other countries are doing who are getting better at this. But man, you're seeing schools shut down. One of the things that I think is a concern in our own community. I spoke to a student who's from LA, but at the University of Pennsylvania, first generation student, freshman, and he got an email from the school saying you have 72 hours to leave and go home. And he said, I don't have money to go home. So, even outside of the things that are top of mind for us, this is impacting our community in ways that we don't even think to right now. Putting on your community leader and dad hats, how how are you getting through this as a human being outside of being a doctor?
Well, we just found out that our kids' schools have closed, like many others right now. Um, Fortunately, we have great family support. My mom and my mother-in-law live close by, and we are fortunate enough to be able to have a nanny to get through this. But that's the problem, right? And if you look specifically at the Korean community, a lot of these people are small business owners that spend 15 plus hours a day at the store, who don't really have health insurance, who have never taken a day off because they just can't afford to. And now they're seeing their marginal salaries dry up because people are not showing up at their stores. People are not going out. And there's no safety net for these people. And so one of the things I think we need to advocate for is to speak to our local representatives. It's interesting, the Democrats recently wanted to set aside funds for sick leave, and particularly for small business owners, and to expand Medicaid because a lot of these people don't have health insurance, so then they could go get tested. But you're already seeing sort of this divide. And I'm not trying to be political here, but it is really unfortunate that you're talking about bailouts for the airline industry, but you're not talking, which is okay, but you call it, some degree of welfare or socialism for these hardworking small business owners or people in the gig economy, right, that are working as an Uber driver or, one of these part-time workers. So I think because so many members of our community fall into those areas, that we as a community at large should really be calling our congressmen and women, our senators, and demanding that they take action to really take care of these people right now in their time of need. I can say especially, with regard to Orange County, there are so many Asian American small business owners that are going to really reach financial ruin if this drags on much longer, which is quite possible. So I think those are steps as we as a community can do, and that we really should consider this all in together. Perhaps we may even start to need to do some sort of community fundraising to help these people, because this is a real devastating impact we're gonna see, unlike we haven't seen in a long time.
Yeah, I think it's, we're learning so much new information every day that changes our perspective and stance. And what I am glad about is that I think more and more people are at least accepting that this could be a larger thing than we ever have known. So I think that's good. In LA, I just read this morning that one of the city councilmen had proposed some sort of a fund for businesses in his district to help them pay rent. So I think there's a lot of different ways that we can help small businesses get through. Obviously, this is such a cyclical effect. If you're not making money and you're staying home, then you can't go buy food, and which impacts the restaurant, and they can't pay their. So it's this never-ending vicious cycle, it seems. But hopefully, things like maybe it's helping commercial landlords with their mortgages or on that back end, so that it provides some relief. We've all read that in Italy, they've paused mortgage payments for the whole country. I'm not certainly optimistic that we would see that here. Just the impact and the scale of that is daunting. But I do hope, and I do appreciate you for encouraging us to reach out to our people that we've elected into office to help us in times like this. And good or bad, there are multiple agencies and multiple layers of the American government system, local to state to federal, that I think we have to trust in those people who've sworn to help people in times like this to do the right thing. This week and the past couple of weeks has been really challenging for a lot of us because of a lot of the racist attacks. Just yesterday, random Korean woman walking into a building was punched in her face, asking, in expletives, "Where's your mask?" So I want to say this, and I get happy to take your thoughts on it. Whether you're Asian American or not, using this or anything else as a excuse to be racist or to make light of the situation is not acceptable. Not only is it not acceptable, I ask you, if you're watching this or hearing this, say something. If your friends are posting funny, quote unquote, memes about race-based coronavirus things, call them out, ask them to take it down. It's not funny. People getting physically attacked. I actually want to take a moment to shout out Benny at Next Shark, whose team has been working tirelessly to report and collect stories that we've seen do so much good already, particularly with the older gentleman in San Francisco. But we need everybody in times like this to say something, particularly, and I'll make a ask to all of my non-Asian American friends, or our allies and our friends or bystanders, say something, because it may actually mean a lot more coming from you, because this is not a foreign virus. This is not a particular country virus. This will impact anybody, skin, religion, doesn't matter. It's unfortunate, but yesterday when two high-profile Hollywood actors shared that they had it, some people said, oh, wow, it's really serious. Or when the NBA suspended their season, they said, oh, with a little bit of humor, oh, sucks. I can't watch basketball, but I guess it's really serious. And I wonder, what is it going to take for all of us to be collectively on the same page, to stop traveling, to cancel events, for pastors to unilaterally say no church this Sunday. It's not worth it. So I don't have any of the answers. I don't think any of us does, but we can care, and we can use empathy and kindness as fellow human beings. Again, like you said, Dr. Song, it's not about politicizing anything, but at the end of the day, sort of the last line of defense is the worst insured person in the country. And if we look at it from that perspective, and you can hide in your mansion or your fancy high-rise tower, but you know what? People deliver food there. People who work the front door or the bellhop, they're not, have the same insurance as you. So I am optimistic, ever so optimistic, even through all this, that this is good for the community, that we've, through very challenging and even more upcoming challenging times, that maybe our empathy muscles will be shaken a little bit.
I think those are wonderful words, and my hope is that in a country that's so divided right now, in some respects, in a world that's so divided, that we could potentially come together and solve this together rather than pit each other against each other. One thing I would just say is that people should not lose hope, as much as this is going to cause some harm in the next coming months. We can see by the success that China and Korea have had at containing this and greatly reducing it. Put in perspective, at its peak, China was reporting 3,500 cases a day. 2 days ago, it reported less than 30 cases a day. So we know that they and Korea have a good handle on how to control this and how to eventually burn it out. I think our country could learn a lot from that, and hopefully they follow suit. I also hope that, again, regardless of where people are on the aisle, that this will realize that we're all in this together, and this virus is not going to discriminate from whether or not you're a Republican or Democrat, rich or poor. It's going after everyone.
Awesome. I want to thank you again for taking the time. The ask came less than 48 hours ago, and you were willingly happy to come and share your thoughts with us. I don't know what the future holds for us in terms of how this is going to impact our community. But I think in this moment where a lot of us don't even know who to believe anymore, or thoughts about media and pundits aside, to hear from somebody who is not only going through it as a doctor, observing the situation from a medical lens, but as a parent, as a husband, as a son of elderly parents, and as somebody who cares deeply about our community and has shown it for a lot of your life. I just want to say thank you for sharing your thoughts. I don't know if we'll be forced to make this a regular thing, and if I have to continue to check in. I hope that it is not the case. And but it's a particularly trying time for a lot of us from a number of different angles. So appreciate the work that you do. Hope you get some rest and continue the good fight.
Well, thank you for all you're doing to bring attention to this and educating our community. Thank you very much.
Thanks, Paul.